I had lost my job due to a disability, and I had no insurance. I needed a lot of medication.
I didn't expect my life to make such a big turn when I lost my job. So, you know, it was kind of a rough thing to go through, a rough spot.
I'm a diabetic, and what it is, I'm insulin dependent. My pancreas does not produce enough insulin in order to digest the food, so I had to have insulin in order to be able to live.
I have severe bipolar disorder.
Several people that were professionals told me to come here, and of course I didn't want to. I just thought, you know, what do I have to do for free medicine, you know?
From 30 years in a factory, I was down to nothing. No job, lost my car, lost my apartment after losing my job.
So I came down and I talked to the receptionist, Kim, and that same day they got me a glucometer and helped me out. And then also they made arrangements for me to get my other prescription medications, which my diabetic supply.
When I talk to a client that calls and they're in need of medication or optical services, and we're able to help, the reply I get is joy, pure joy.
I was never able to afford, you know, all the medication that I was supposed to be on.
It got to the point where I was skipping medicines because I was only being able to buy them once a week. Instead of once a month, I could only pay for medicine once a week.
I could have gotten health insurance after my job, but it was like $300 a month, and I couldn't afford that either. So I just kind of prayed a lot that I wouldn't get sick.
You know, I've been living all these years without my medication, you know, and I didn't even know there was an option until I was at the other clinic on the other side of town, and the guy's like, well, here, let me give these prescriptions. And I'm like, you can give me the prescriptions, but it's not gonna do any good. I don't have any money to buy the prescriptions with because I can't get a job. And he said, well, check out the free clinic.
What's very fulfilling about the work that we do here, so many of the clients are so appreciative of the work that we do. They've come back to us and told us that we've made a difference in their lives, that we have provided them with care that they knew they couldn't get elsewhere, and they know that when they had no place else to turn, that the Holland Free Health Clinic was able to help them, and that people in this community do care.
We filled out all the paperwork and we showed my income level, we showed my little bit of payroll that I get from my part-time job, and I qualified for this free medicine. So now I'm on the right medicine that works for me.
Just being able to talk to different people, hear their stories, and give them some type of hope, advice, it was just, I love it.
I walked in scared, and I came out with a smile and dignity. It really, really helped me tremendously.
I thank God every day for this program. I really do, because I have struggled, and they've made my life a lot easier.
They call me and they say, you know, how's the medicine going? You know, everything's still okay. You know, we're just calling to, you know, see, you know, to let you know that, you know, we're ordering your refills, you know, and that it'll be to you soon.
It was a blessing in my life that I didn't have to wonder what I was going to miss paying for to buy my medicine.
You know, thanks to generous donation by people who care, you know, I'm able to have people help me, you know, get my medications. And so I would think that if, you know, anybody was talking about doing this, that I would let them know that I would appreciate it. You know, I'd appreciate whatever they did, because they're helping a lot of people who can't get help otherwise.
The reason why I feel though that anyone who's able to help, to give to a clinic that freely gives back, that treats each person with respect, no matter race, religious, creed, or color. You know, this place right here, they didn't ask me, you know, anything that was disrespectful. Everybody's courteous. You know, this is what I feel that life should be about, one person helping another.
We put smiles on the client's face. We put tears in clients' eyes. When you're happy and you're joyful, you cry, you know, but they're tears of joy.
One thing I love about the place, they don't look down on me. They accepted me just where I was at. And that was at my lowest, I was at my bottom. And without this place, I might have been farther in my bottom, I might have been in my grave.
I would like to thank the people, the doctors, the eye doctor who did my exam, and the people and the dentist. They don't get anything for this, except hopefully the satisfaction that they might be helping someone.
This is truly a blessing. You know, this is what I believe that church should really be about, you know, helping people help themselves. You know, many times we use the money for the wrong thing, but in this instance, it's faith in action, it's work, and I can see that, you know, and that's a blessing.